The ambulance sirens wailed in the distance, growing louder with each passing second. The emergency room of Mercy General Hospital was already in chaos when the first radio call came through. A school bus had collided with a semi-truck on Highway 35, and the casualties were numerous. Nurses and doctors rushed about, preparing trauma bays, checking supplies, and bracing themselves for what was coming. In the midst of this controlled chaos stood Laura Keating, her brown hair pulled back in a practical ponytail, her blue scrubs pristine despite the morning's earlier emergencies. She moved with quiet efficiency, checking IV bags and medication carts, while others shouted orders across the room. The fluorescent lights cast harsh shadows across her face, highlighting the subtle lines around her eyes that suggested she was older than her 32 years, or perhaps that she had seen more than most people twice her age. Laura's movements were precise, almost choreographed, as she methodically verified each medication label against the hospital's color-coding system, a precaution most of the other nurses skipped during emergencies. Her fingers moved with surprising dexterity, uncapping and recapping vials, adjusting drip rates with microscopic precision. Nearby, two younger nurses fumbled with equipment, their anxiety palpable as the radio squawked with updates about the incoming casualties. Laura glanced their way, then silently moved to assist, reorganizing their trauma cart without a word. The younger nurses nodded gratefully, but Laura had already turned away, her attention caught by the sound of the first ambulance pulling into the bay. Dr. Richard Whitmore, the ER's chief physician, strode into the center of the department, his voice booming over the noise. "Listen up, people. We have 14 incoming victims, multiple traumas. Mason and Rodriguez, you're on primary assessment. Parker and Williams, you're running trauma bays 1 through 4. His eyes landed on Laura, who was meticulously organizing a crash cart. "Keating, you're on paperwork and intake. Keep the charts moving and stay out of the medical decisions." Laura nodded once, her face revealing nothing as she moved to the intake desk without protest. Whitmore was a tall man with prematurely silver hair and the confident bearing of someone who had spent decades making life and death decisions. At 54, he ran the ER with military precision, though he had never served a day in his life. He had a reputation for being brilliant but abrasive, demanding perfection from his staff, while offering little in the way of praise or encouragement. His dismissive assignment to Laura didn't seem personal. It was simply that he had categorized her weeks ago as competent but unremarkable, too methodical for the high-pressure environment of emergency medicine. As the first victims were wheeled in, the department erupted into controlled pandemonium. Monitors beeped urgently, staff called out vital signs and assessments, and the metallic clatter of equipment provided a constant backdrop to the human drama unfolding in each bay. Laura sat at the intake desk, efficiently processing paperwork, but her eyes never stopped moving. She watched each patient as they came through the doors, her gaze clinical and assessing. When the paramedics brought in a middle-aged woman with facial lacerations and a suspected broken arm, Laura's eyes narrowed slightly as she noted the woman's pallor and the slight tremor in her hands. "Possible internal bleeding," she murmured to herself, making a note on the chart before passing it to Dr. Mason, a second-year resident with dark circles under his eyes from a 30-hour shift. "You might want to check her abdomen," Laura suggested, quietly. Her BP's borderline, and she's showing early signs of shock, despite minimal visible trauma. Mason glanced at her irritably. "I know how to assess a trauma patient, Nurse Keating. Just handle the paperwork like Dr. Whitmore said." He took the chart and moved to the patient, leaving Laura at the desk, her expression unchanged, except for a slight tightening around her mouth. She watched as Mason performed a cursory examination, ordered basic labs and an X-ray for the arm, then moved on to the next, more visibly injured patient. Laura made another note in her small personal notebook before returning to her assigned task. 3 hours later, the ER still buzzed with frantic energy, but something had shifted. A teenage boy with a seemingly minor head injury had begun seizing unexpectedly. Before the attending physician could even call for anti-seizure medication, Laura had already prepared the correct dosage and was at the bedside, calmly explaining to the resident how to administer it while positioning the patient to prevent aspiration. In Bay 3, an elderly man's blood sugar had plummeted dangerously low, while the doctors focused on his more obvious injuries. Laura had silently slipped him orange juice, averting a diabetic crisis before anyone else had even noticed the symptoms. And in Trauma Bay 1, she had somehow convinced Dr. Whitmore to rush a young mother with abdominal trauma to surgery, based on nothing more than a slight discoloration near her flank that no one else had observed. The teenage boy's mother clutched at Laura's arm as her son's seizure finally subsided. "How did you know what to do so quickly?" she asked, tears streaming down her face. The other nurse said he was fine just 15 minutes ago. Laura gently extricated herself from the woman's grip, checking the boy's vital signs as she spoke. "I noticed his right pupil was sluggish when they first brought him in. With head injuries, deterioration can happen rapidly." She spoke matter-of-factly, without condescension or unnecessary medical jargon. "He's stable now, but they'll need to do a CT scan to check for bleeding." She made a note on his chart, then disappeared before the woman could thank her further. In Bay 4, Dr. Rodriguez was struggling with an elderly patient who had become combative. The man, in his 80s with wispy white hair and paper-thin skin already bruising from earlier 4 attempts, was swinging his arms and shouting incoherently. 2 nurses were attempting to restrain him while Rodriguez tried to assess his injuries. "We need to sedate him," Rodriguez said firmly, reaching for the medication cart. "He's going to hurt himself or one of us." Laura appeared at his side, her voice low but clear. "Before you sedate him, check his oxygen saturation. His lips have a slight blue tinge, and altered mental status could be from hypoxia, not agitation." Rodriguez frowned, clearly annoyed at the suggestion, but something in Laura's quiet certainty made him pause. He glanced at the monitor, which showed the patient's oxygen level at 87%, significantly below normal. "Get him on high-flow oxygen," he ordered immediately, his irritation forgotten. Within minutes of oxygen administration, the elderly man began to calm, his combativeness replaced by confusion. Then, clarity. "Where am I?" he asked, his voice tremulous but rational. "What happened to the bus?" Rodriguez gave Laura a brief, appraising look before turning his attention back to the patient. Laura had already moved on, stopping briefly at the bedside of the middle-aged woman Mason had assessed earlier. The woman now lay pale and sweating, her vital signs deteriorating as her untreated internal bleeding progressed. Dr. Mason, a young resident who had been struggling with a middle-aged woman in hypovolemic shock, watched in astonishment as Laura stepped in, adjusted the fluid resuscitation protocol, and stabilized the patient in minutes. "Who trained you like this?" he asked, his voice barely audible over the beeping monitors. Laura simply smiled and returned to her paperwork at the nurse's station, leaving him standing there, perplexed. The woman's blood pressure had dropped dangerously low, her skin clammy and cold to the touch. Mason had ordered fluids and blood products, but something wasn't working. The patient continued to deteriorate despite his interventions. Laura had approached quietly, observing for a few moments before speaking. "The IV in her left arm has infiltrated," she had said calmly, "and she needs a vasopressor along with the fluids. Her cardiac output is too low to perfuse her organs effectively." When Mason hesitated, Laura had simply stepped in, established a new IV line with remarkable speed, adjusted the medication orders on the computer, and administered the correct treatments, while explaining each step to Mason as if they were collaborating rather than her taking over. By the time she finished, the patient's vital signs were trending upward, her color improving visibly. Now, as Laura walked away from the astonished resident, she felt a familiar weariness settling into her bones. It wasn't physical tiredness, though the shift had been grueling, but the emotional toll of navigating the delicate balance between using her skills and remaining in the background. Every time she stepped forward to intervene, she risked drawing attention to herself, raising questions about her background and expertise. Yet every time she held back, she risked a patient suffering unnecessarily. It was a constant calculation, one that never got easier no matter how many shifts she worked. Laura Keating had joined Mercy General 3 months ago. At 32, she wasn't exactly young for a staff nurse, but her resume showed nothing extraordinary: nursing school in the Midwest, a few years at a community hospital in a small town, and then her application to Mercy General in the city. What her resume didn't explain was her unusual approach to emergency medicine. In a department where speed was valued above all else, Laura was methodical. She kept a small notebook in her pocket, jotting down observations about patients that seemed insignificant to others. She double-checked medication doses that experienced nurses administered without a second thought. She spent extra moments with patients, observing their breathing patterns or the subtle changes in their skin color when others were rushing to the next case. Her colleagues had initially mistaken her thoroughness for incompetence or insecurity. Too slow for the ER, nurse manager Diane Patterson had commented during Laura's first performance review. "You're detail-oriented, which is great for the ICU, but down here, we need speed. You're going to burn out if you try to be perfect with every patient." Laura had nodded, promised to work on her efficiency, and continued exactly as before. The truth was, her careful observations had already saved 3 lives in her first month, though no one had connected those saves to her quiet interventions. Laura's morning routine never varied. She arrived at the hospital 45 minutes before her shift started, changed into her scrubs in the locker room, and did a methodical check of every emergency bay before the day began in earnest. She verified crash cart contents, checked expiration dates on critical medications, and mentally mapped the location of every piece of equipment she might need during her shift. This pre-work ritual drew occasional teasing from her colleagues. "There goes Keating," counting the gauze pads again, but Laura ignored them, her face impassive as she completed her preparations. She lived alone in a small, sparsely furnished apartment 20 minutes from the hospital. Her neighbors knew her only as the quiet woman in 3B, who sometimes returned home at odd hours, still wearing scrubs under her coat. What they didn't see was how she spent her evenings reading medical journals, studying new trauma protocols, and maintaining a physical fitness regimen that would have impressed military drill instructors. 3 times a week, she visited a shooting range, though she no longer owned a firearm. "Just to keep my eye in," she explained to the range owner when he asked why she came so regularly. He assumed she was former law enforcement and didn't press for details. The only personal items in Laura's apartment were a framed photograph of 6 young men in military fatigues, arms slung around each other's shoulders in the bright sunlight of a desert outpost, and a small wooden box containing medals she never displayed. There were no family photos, no mementos from trips or celebrations, nothing to suggest a life outside of her work and her carefully guarded past. What her colleagues also didn't notice was the way Laura carried herself, the economy of movement, the precise, almost military posture, or the way her eyes constantly scanned the room, assessing threats and resources. They didn't see the silver pen she kept in her breast pocket, engraved with the initials DP. Nor did they question the bracelet she never removed, a simple silver band with coordinates engraved on the inside. Coordinates that would lead to a dusty street in Mosul, Iraq, if anyone had bothered to check. The pen had belonged to Daniel Pierce, a young medic who had served under Laura in her final deployment. He had died on her operating table during a firefight. His last words, a request for her to contact his parents and tell them he wasn't afraid at the end. Laura had kept that promise, traveling to a small town in Nebraska after her return to the States, sitting in the Pierce's living room as they wept and thanked her for being with their son in his final moments. Before she left, Mrs. Pierce had pressed the pen into her hand. "Danny would want you to have this," she had said. "He wrote to us about you, about how much he admired you. He said you were the best damn medic in the Army, and that if he was ever hit, he hoped it would be you patching him up." Laura had accepted the pen silently, unable to tell them that she had failed their son, that despite all her training and experience, she couldn't save him from an injury that would have been fatal, even in the best-equipped trauma center. The bracelet was her own reminder, commissioned after her return to civilian life. The coordinates marked the exact location where her unit had been hit by the IED that had changed everything. Laura didn't wear it out of sentimentality or pride, but as a daily reminder of the cost of mistakes, of the thin line between life and death, and of her responsibility to use what she had learned in that dusty hell to save lives in the sterile halls of Mercy General. Laura moved through the emergency department like a ghost, present but unseen. She started IVs on difficult veins that had left other nurses frustrated. She adjusted oxygen flow rates by tiny increments that made the difference between adequate and optimal saturation. She noticed when cardiac monitors showed subtle rhythm changes that preceded major events. These small interventions rarely drew attention. They were silent course corrections that kept patients from veering into crisis rather than dramatic rescues from the brink of death. but they saved lives nonetheless. How do you always get the IV on the first stick? Jessica Barnes, a nurse who had joined the department just 6 months earlier, asked Laura one quiet night shift. Jessica was in her mid-20s, eager and intelligent, but still developing the technical skills that came with experience. I had to stick Mrs. Reynolds in bed 3 times before I got a line in. Laura glanced up from the medication chart she was reviewing. It's not just about finding the vein by sight or touch, she explained, setting down her pen. Watch how the patient holds their arm. Check the temperature of their skin. Look for subtle signs of dehydration that might make access more difficult. And always prepare everything before you stick. There's nothing worse than getting a flash of blood and then fumbling for your equipment. Jessica nodded earnestly, clearly filing away the advice. Where did you learn all this? Your technique is different from what they taught us in nursing school. A shadow crossed Laura's face, so briefly that Jessica might have imagined it. Just experience, Laura said, her voice neutral. Different settings require different approaches. She picked up her pen again, effectively ending the conversation. There was the time when a 7-year-old boy came in with what everyone assumed was a simple case of the flu. Laura had noticed his pupils were slightly unequal and convinced the attending physician to order a head CT, revealing a small subdural hematoma from an undiagnosed fall days earlier. Or the elderly woman complaining of indigestion whom Laura had moved to a cardiac bay, insisting on an EKG that revealed a silent heart attack in progress. These silent miracles, as one of the more observant residents had begun to call them, happened with increasing frequency. Yet somehow Laura remained invisible, moving through the department with quiet efficiency while louder, more confident nurses received recognition for far less significant accomplishments. Dr. Parker, one of the younger attending physicians, had started to take notice of these patterns. Unlike Whitmore, whose attention was often divided among administrative duties and the most critical cases, Parker worked alongside the nurses more closely and had observed Laura's subtle interventions. One afternoon, he cornered her in the medication room. "You know, Keating, I've been watching you," he said conversationally as he checked the controlled substances log. "You've got instincts I haven't seen in nurses with twice your experience. Where did you work before coming here?" Laura's face remained impassive as she counted medications for her patients. "Small community hospital in Ohio," she answered without elaboration. "Nothing special." Parker raised an eyebrow. "And before that? You move like someone with trauma experience. Were you with an aid organization overseas, maybe? Doctors Without Borders?" Laura closed the medication drawer with a soft click. "No, nothing like that. Excuse me, I need to get these to my patients." She slipped past him and out of the room, leaving Parker staring after her, his curiosity unsatisfied. The contrast between Laura's approach and that of her colleagues was never more apparent than during trauma cases. Most of Mercy's ER staff operated with controlled chaos, shouting orders, moving quickly, making split-second decisions based on instinct and experience. It wasn't uncommon to hear multiple people talking at once, monitors beeping, and equipment clattering as treatments were initiated and changed rapidly. Laura, meanwhile, worked with an almost unnerving calm. She spoke softly but clearly, moved deliberately, and often seemed to anticipate needs before they were voiced. In the midst of emergencies, she became even more focused and methodical, as if the pressure clarified rather than clouded her thinking. Diane Patterson, the nurse manager, who had criticized Laura's methodical approach during her performance review, found herself reconsidering her assessment after observing Laura during a particularly chaotic trauma case. A construction worker had fallen 3 stories, suffering multiple fractures and a pneumothorax. While other nurses rushed around, shouting for equipment and struggling to keep up with the rapid-fire orders from the trauma surgeon, Laura moved with precision and economy, always exactly where she needed to be, his equipment in hand before it was requested. "How do you stay so calm?" Diane asked later, when the patient had been stabilized and transferred to surgery. "Everyone else was running around like their hair was on fire, but you looked like you were just having a normal Tuesday." Laura shrugged slightly as she documented her care in the electronic health record. "Panic doesn't help the patient," she said simply. "And it's easier to think clearly when you're calm." Diane studied her for a moment. "Were you always like this? Or did something happen that made you this way?" Laura's fingers paused briefly on the keyboard, her eyes fixed on the screen. "Experience changes everyone," she said after a moment. "You learn what works and what doesn't." She finished her documentation and logged out of the computer before Diane could ask any more questions. That night, in the quiet of her apartment, Laura stood at her kitchen window, staring out at the city lights without really seeing them. Diane's question had struck closer to home than the nurse manager could have known. No. Laura hadn't always been this way. There had been a time when she was as flustered by emergencies as any novice medic, when the sight of blood made her stomach clench, when the cries of pain from wounded soldiers sent adrenaline coursing through her system in a fight-or-flight response that she had to consciously suppress. But Mosul had changed all that. After the IED, after hours of working on the wounded with nothing but basic supplies and her training, after watching 2 men die despite her best efforts and saving 6 others through sheer determination and skill, something in her had shifted. It wasn't that she didn't feel fear or stress anymore, it was that she had learned to channel those emotions, to use the heightened awareness they brought, without succumbing to the paralysis or chaotic energy they could induce. In the crucible of combat medicine, she had developed a preternatural calm that now served her patients at Mercy General, even if her colleagues found it disconcerting. On this particular day, as the victims of the bus accident continued to arrive, Laura's unique approach was put to its ultimate test. The radio crackled with another update. "Mercy General, this is Rescue 3. We're incoming with 2 critical patients from the bus collision. First is a 37-year-old female with suspected internal bleeding and pelvic fractures. Second is an 8-year-old male with head trauma and possible spinal injuries. ETA, 4 minutes. Dr. Whitmore looked around the already overcrowded emergency department. "Damn it," he muttered. "We're at capacity." "Keating," he called out. "Get on the phone with County. See if they can take some of these patients." Laura nodded and reached for the phone. But her eyes were fixed on Bay 5, where a woman in her 40s was lying too still, her face ashen despite the 2 units of blood she'd already received. As soon as Dr. Whitmore turned away, Laura set down the phone and moved swiftly to Bay 5. The monitor showed the patient's blood pressure dropping steadily. The resident, assigned to her case, was currently intubating another patient. Without hesitation, Laura increased the fluid rate, called for additional blood products, and began checking the woman's abdomen. Her hands moved systematically across the patient's torso until they paused over the right upper quadrant. Laura's eyes narrowed, and she called out clearly, "Dr. Mason, we need you in Bay 5 now. Patient's going into hemorrhagic shock." Dr. Mason looked up from his current patient, annoyed at the interruption. "She's already getting blood. I'll be there when I can." "She needs surgery now," Laura insisted, her voice calm but firm. "I suspect a liver laceration. Her abdomen is distending, and there's increasing dullness in the right upper quadrant." Something in Laura's tone made Mason look more closely at her, then at his patient. He quickly finished what he was doing and hurried over. One examination later, he was calling for an emergency surgical consult. "How did you catch this?" he asked Laura, as they prepared the patient for transfer to the OR. Laura shrugged. "Just experience," she said, already moving toward the next bed, where a teenage boy with a head injury had begun showing signs of increasing intracranial pressure before anyone else had noticed. Mason shook his head, watching her go. "That's the 3rd time today she's been right about something I missed," he muttered to a nearby nurse. "And she's supposed to be doing paperwork." "That's Laura for you," the nurse replied with a slight smile. "Always where she's not supposed to be. Doing what she's not assigned to do. But I've never seen her make a mistake." Throughout the afternoon, similar scenarios played out across the emergency department. Laura seemed to be everywhere at once, not managing any patients officially but somehow intervening at critical moments to redirect care, suggest diagnostic tests, or implement treatments that others had overlooked. She did it all quietly, often phrasing her interventions as questions or gentle suggestions, rather than direct challenges to the physician's authority. But the impact was undeniable. In Trauma Bay 2, a 10-year-old girl with no visible injuries except a small abrasion on her forehead had begun complaining of severe abdominal pain. The resident assigned to her had ordered pain medication and was preparing to send her for a routine abdominal CT when Laura appeared at his side. "Before you give that pain medication," she said quietly, "check her vital signs again. Her heart rate is increasing, and her blood pressure is dropping. She needs an ultrasound now to check for free fluid in the abdomen." The resident frowned. "She was fine 5 minutes ago. Vitals were stable. Children compensate until they crash," Laura replied, her voice taking on a hint of urgency. "Trust me on this one." Perhaps it was the intensity in her eyes. Or perhaps the resident had begun to notice the pattern of Laura's interventions being proven correct. Whatever the reason, he nodded and called for a portable ultrasound machine. Minutes later, he was rushing the child to surgery for repair of a ruptured spleen that would have likely been fatal if they had waited for the CT scan. By late afternoon, the chaos had begun to subside. The most critical patients had been stabilized or transferred to surgery or intensive care. The less severely injured were being treated and prepared for admission or discharge. Dr. Whitmore stood at the nurse's station, reviewing charts and trying to make sense of the day's events. Something was bothering him, something he couldn't quite put his finger on until he looked across the department and saw Laura efficiently organizing supplies, her movements precise and economical. It wasn't just that she had been effective today, many of his staff had performed admirably under pressure. It was the way she had done it. Her hand movements when starting fours or checking pulses, the rhythm of her assessments, the clarity and brevity of her communications, they all spoke of a specific kind of training, one rarely seen in civilian hospitals. And then there was the bracelet he had glimpsed, when her sleeve rode up as she reached for supplies on a high shelf, a plain silver band with numbers engraved on it. Coordinates, he realized suddenly. As he watched, Laura knelt beside an elderly man who was waiting for transport to a regular hospital room. The man was agitated, repeatedly trying to get out of bed despite his injuries. Laura spoke to him softly, her hand on his arm, and within moments, he had calmed. She adjusted his pillows, checked his IV, and made a note on his chart before moving on to the next patient. There was nothing extraordinary about the interaction, yet something in the way she handled the man, the perfect balance of authority and compassion, nagged at Whitmore's memory. "Dr. Whitmore?" A nurse handed him a chart requiring his signature. He scrawled his name absently, his eyes still on Laura as she moved efficiently through the department. "Is everything okay?" the nurse asked, noticing his distraction. "Fine," he muttered. "Just thinking." He handed back the chart and retreated to his office, closing the door behind him. Something was tugging at his memory. A conversation with an old friend. A story about a medic in Iraq or Afghanistan. He couldn't quite place it, but he knew it was important. It had something to do with a field procedure under fire, something extraordinary. Dr. Whitmore pulled out his phone and stepped into his office for privacy. He scrolled through his contacts until he found the name he was looking for. Marcus Taylor, an old friend who had served as a military physician before joining the staff at Walter Reed. The call connected after 3 rings. "Marcus, it's Rich Whitmore. I need to ask you something. Do you know or have you ever heard of a combat medic named Laura Keating?" There was a pause on the other end of the line, followed by a low whistle. "Laura Keating? Man, where did you run into her? She's working as a nurse in my ER. Has been for about 3 months now. Why? Who is she?" Marcus's voice dropped slightly, taking on a reverent tone that Whitmore had rarely heard from his usually cynical friend. "Rich, if you have Laura Keating in your ER, you've got yourself a living legend. She was a senior combat medic, one of the best the Army ever produced. There's a story about her in Mosul. Her unit was hit by an IED, and she kept 6 critically wounded soldiers alive for 4 hours under enemy fire, performing 2 field amputations and a thoracotomy with minimal supplies while waiting for evacuation. The military wanted to give her a Silver Star, but she declined any public recognition. After that tour, she left the service. I heard she'd gone completely civilian, but I didn't know where she ended up." Whitmore felt his mouth go dry as he looked through his office window at the unassuming woman organizing medical supplies. The woman he had relegated to paperwork and intake. The woman who had saved at least 4 lives today through quiet, precise interventions that he had barely noticed at the time. Was she trained as a nurse before joining the military? he asked, trying to reconcile the ordinary resume he had reviewed 3 months ago with the extraordinary background Marcus was describing. No. She was a medic from the start, Marcus replied. But she was different from most. Had this uncanny ability to stay calm under pressure, to see patterns others missed. There were rumors she could predict which patients would crash before their vitals even changed. Some of the guys called her the witch. Because of it, but with respect, you know. She had the lowest mortality rate of any combat medic in her region, despite often getting the worst cases. And she never talked about it? Never used her reputation to advance her career? Marcus laughed, a short, surprised sound. Keating? No way. She was notorious for avoiding recognition. After that incident in Mosul, the brass wanted to do a whole media thing, hometown hero saves brothers in arms, that kind of story. She refused, threatened to resign her commission if they pushed it, said she was just doing her job, same as anyone else would have done. Whitmore thought about the quiet, efficient nurse who had spent the day saving lives without drawing attention to herself, who had accepted the menial assignment of paperwork without complaint, even as she spotted critical issues that experienced physicians had missed. That sounds like her, he said softly. Thanks. Marcus, he said distractedly. I need to go. He ended the call and sat at his desk for several long minutes, processing what he had just learned. Then he stood up and walked purposefully toward Laura, who was now in the nearly empty staff break room, sipping a cup of tea and making notes in her small notebook. Nurse Keating, he said formally, may I join you? Laura looked up, her expression neutral, but her eyes alert. Of course. Dr. Whitmore. She closed her notebook and set it aside. Whitmore sat across from her, studying her face. Now that he was looking for it, he could see the shadow of her experiences in the fine lines around her eyes, the watchful quality of her gaze, the way she positioned herself with a clear view of the door. I owe you an apology, he said finally. Laura raised an eyebrow. For what? For underestimating you. For not seeing what was right in front of me. He paused, then decided to be direct. I spoke with Marcus Taylor at Walter Reed. He told me about Mosul. Laura's face remained impassive, but something flickered in her eyes, a brief shadow of memory, quickly suppressed. She was silent for a long moment, then sighed softly. I didn't put that experience on my resume for a reason, Dr. Whitmore. Why not? You could have walked into any ER in the country and had your pick of positions. With your experience, you could be running a trauma unit. Laura traced the rim of her teacup with one finger, her eyes distant. I don't want to be that person anymore, she said quietly. I don't want to be the combat medic from Mosul. I just want to be a nurse, doing my job without the weight of that reputation. But today was an exception, she interrupted gently. When lives are at stake, you fall back on your training. It's instinct. But I don't want or need recognition for it. Whitmore leaned forward, his curiosity overcoming his usual professional distance. What happened in Mosul? The real story, not the legend. Laura was quiet for so long that Whitmore thought she might not answer. When she finally spoke, her voice was soft but steady, her eyes focused on something only she could see. We were on a routine patrol. The IED took out our lead vehicle. 6 men down. Various injuries, from shrapnel wounds to traumatic amputations. We were taking fire from at least 2 positions. The radio was damaged in the blast, so we couldn't call for immediate evacuation. She paused, took a sip of her tea. I had 2 bags of plasma, a field surgery kit, and whatever I could salvage from the medical supplies in the damaged Humvee. The nearest cover was a partially collapsed building about 20 meters away. She described the next 4 hours with the clinical detachment of a medical report. But Whitmore could see the cost of that detachment in the tightness around her eyes, the careful control of her breathing, how she had dragged the wounded men one by one to shelter under sporadic enemy fire, how she had triaged on the fly, performing emergency procedures with minimal equipment while keeping an eye out for attackers, how she had talked continuously to the men who were conscious, keeping them calm and focused on her voice rather than their injuries or the gunfire outside. The first amputation was on Private Reynolds, she continued. her voice now barely above a whisper. His right leg was crushed under the vehicle frame, mangled beyond repair. He was conscious through the whole procedure. I had morphine, but not enough to put him under completely. So I talked to him about his hometown in Georgia, about the fishing trips he was going to take when he got home, about anything I could think of to keep his mind off what I was doing to his leg. She fell silent again, staring into her teacup, as if it contained the memories she was sifting through. The thoracotomy was on Sergeant Miller. Tension pneumothorax from a shrapnel wound to the chest. No chest tube kit in the salvaged supplies, so I had to improvise with what I had. Used a pocket knife to make the incision, the barrel of a ballpoint pen as a makeshift chest tube. Not exactly standard protocol. When the rescue team finally arrived, all 6 were still alive, she concluded. 2 lost limbs, 1 lost an eye, but they all made it home. They called it a miracle, but it wasn't. It was just proper training and a lot of luck. And after that? Whitmore prompted gently. Laura's gaze returned to the present, focusing on Whitmore's face. After that, I realized I'd had enough of miracles under fire. When my tour ended, I left the army and went to nursing school. I wanted to save lives without the sound of gunfire in the background. I wanted to work somewhere where success didn't mean watching young men go home missing parts of themselves. But why hide your experience? Why start over as a staff nurse when you could be doing so much more? Laura smiled, a small, sad expression that didn't reach her eyes. That's where you're wrong, Dr. Whitmore. I'm not hiding. And I'm not doing less. I'm doing exactly what I want to be doing. When you're a combat medic, the lessons you learn come at a terrible price. Every skill I have, I learned because someone was bleeding out under my hands. Every instinct I've developed was paid for in blood and pain, sometimes my patient's, sometimes my own. She rolled up her sleeve slightly, revealing a thin scar running along her forearm. Shrapnel, she explained briefly. From the same IED, she continued, her voice gaining intensity, though it remained quiet. There's something you learn in combat medicine that many civilian doctors never fully grasp. When you save someone, they live. That's a victory, clear and simple. But when you lose someone, their ghost stays with you. You replay every decision, every movement, wondering if you could have done something differently. The weight of those ghosts can break you if you let it. She looked around the empty break room, then back at Whitmore. Here, I can use what I know without carrying the title and expectations that come with it. I can teach by example rather than authority. And, most importantly, I can be part of a team without having to be the hero who sweeps in to save the day. Whitmore considered her words. But today, you were that hero. Multiple times. Laura shook her head firmly. Today I was a nurse who used her training to help patients and support her colleagues. That's all I want to be. She stood up, gathering her notebook and empty teacup. I appreciate your understanding, Dr. Whitmore, but I'd prefer if this conversation remained between us. I don't need or want special treatment. Whitmore watched her go, still processing everything he had learned. The woman he had dismissed as too careful, too slow for emergency medicine, was in fact one of the most highly trained trauma specialists he had ever encountered. And she wanted nothing more than to be treated like any other nurse on his staff. In the weeks that followed, Whitmore honored Laura's request. He didn't announce her background to the department or give her special assignments, but he did watch her more closely, and what he saw fascinated him. Laura continued her methodical, detail-oriented approach to patient care, but now Whitmore recognized it for what it was: not caution born of inexperience, but precision born of high-stakes training, where mistakes cost lives. More interesting still was how she interacted with the other nurses, particularly the newer ones. She never formally instructed them, but she had a way of gently guiding them toward better practices. I find it helps to check the distal pulse before and after starting an IV, she might suggest to a nurse struggling with a difficult stick. Or, have you noticed how this patient's breathing changes when he lies flat? Might be worth mentioning to the doctor. Small interventions, subtle redirections, but over time, Whitmore began to see their cumulative effect. Jessica Barnes, a nurse who had been at Mercy for just 6 months, had begun mirroring Laura's methodical assessments. One Tuesday morning, this newfound thoroughness led her to identify subtle neurological changes in a patient with a minor head injury, resulting in the early diagnosis of a stroke that might otherwise have gone undetected for crucial hours. When Whitmore commended her quick thinking, Jessica shrugged and said, "I was just doing what Laura would do, checking everything, even when it seems unnecessary." Similar stories began to emerge throughout the department. Nurses, who worked alongside Laura, started adopting elements of her approach: the careful documentation, the systematic assessments, the attention to subtle changes in patient condition. They didn't know why she did things the way she did, but they recognized the effectiveness of her methods. The impact was gradual, but undeniable. Fewer misdiagnoses, earlier interventions, better patient outcomes overall. Laura herself remained as unassuming as ever. She never sought credit or recognition, seemed content to work her shifts and go home, and continued to treat every patient from the severely injured to those with minor complaints with the same focused attention. The only time Whitmore saw her demeanor crack was during a particularly chaotic trauma case involving 3 young soldiers injured in a training accident at a nearby military base. For a brief moment, as the first victim was wheeled in, Whitmore caught a flash of something raw and painful in Laura's eyes before her professional mask slipped back into place. She worked that case with even more intensity than usual, and afterward, Whitmore found her in the ambulance bay, staring into the distance, her hands trembling slightly before she noticed his presence, and quickly composed herself. 3 months after the bus accident that had revealed Laura's true capabilities, Whitmore found himself reflecting on the subtle transformation of his emergency department. The change wasn't dramatic. They hadn't suddenly become a top-tier trauma center or revolutionized emergency medicine. But there was a noticeable shift in how his staff approached patient care. The nurses moved with more purpose and less panic. The residents were more thorough in their assessments. The atmosphere, while still urgent and sometimes chaotic, had an underlying current of competence that hadn't been there before. And at the center of this transformation, though few realized it, was Laura Keating, not through grand gestures or formal leadership, but through consistent example and quiet influence. She had become, Whitmore realized, a different kind of hero than the one who had saved 6 soldiers in Mosul. Instead of a dramatic rescue under fire, she was orchestrating a gradual elevation of care through hundreds of small actions and gentle guidance. The lives she was saving now might never know her name, might never realize that their positive outcome was the result of practices she had instilled in the nurses and doctors who treated them. Whitmore found himself thinking about other veterans he had known, men and women who had returned from combat zones and integrated back into civilian life. Many struggled to find meaning after the intense purpose of military service. Some chased that same adrenaline in high-risk civilian jobs, while others retreated from challenge entirely, overwhelmed by their experiences. But Laura had found a third path. She had brought the best of her military training into civilian practice without bringing the trauma and drama along with it. She had found a way to continue serving, continue saving lives, but on her own terms, in her own quiet way. One evening, as the department was settling into the relative calm of a night shift, Whitmore noticed Laura standing at the assignment board where nurse staffing was posted. Someone had written in small, neat handwriting beside her name, "Cool head, warm heart." Laura stared at it for a long moment, then smiled slightly, and walked away without erasing it. Whitmore approached the board after she left, studying the simple phrase. It captured Laura perfectly, the combat-trained precision coupled with genuine compassion that made her such an effective caregiver. He thought about their conversation months ago, about ghosts and the price of experience. Laura had found a way to use her hard-won knowledge without being defined or limited by how she had acquired it. In doing so, she had created a legacy more lasting than any combat heroics, a ripple effect of improved care that would continue long after she moved on. The next morning, Whitmore arrived early to find Laura finishing her night shift. She was sitting with an elderly patient, holding his hand and speaking softly to him while checking his IV. The man was smiling despite his obvious pain, responding to the calm reassurance Laura projected. As she stood to leave, Whitmore noticed she was still wearing the silver bracelet with the Mosul coordinates, partially visible beneath her scrub sleeve. Laura caught him looking and glanced down at the bracelet. "I used to wear it to remember what happened there," she said quietly as she passed him in the hallway. "Now I wear it to remember why I'm here instead." She smiled a real smile this time, reaching her eyes and continued toward the locker room to end her shift. Just another nurse completing another day of saving lives in her own silent, powerful way. As Whitmore watched her go, he thought about heroism and its many forms. There were those who performed dramatic rescues, who ran into burning buildings or pulled people from wreckage. Their courage was visible, celebrated, easily recognized. But there were also those like Laura, whose heroism lay in the consistent application of skill and compassion day after day, in the quiet transfer of knowledge that saved lives through others' hands, in the choice to serve without recognition or acclaim. That kind of heroism didn't make headlines or earn medals, but its impact could be just as profound, its legacy even more enduring. In a world that celebrated noise and spectacle, Laura Keating had chosen the power of silence. And in that choice, Whitmore realized, lay a form of courage, perhaps even greater than what she had displayed on that dusty street in Mosul years ago.